Hey there, Dr. Chad Walding, Doctor of Physical Therapy, and I'm going to welcome you to your orientation video for your 2-week home exercise program to help you with your knee pain. And I first want to thank you and acknowledge you for signing up for this program. And in this video, I'm going to be discussing what you can expect over the next few weeks and really how you can get the most out of this program. I'm also going to discuss my philosophy for treating pain naturally and really more about who I am. But it's really my intention to educate you and empower you to treat your pain naturally and get to the root of the problem rather than just treating symptoms and relying on pain pills and pharmaceutical drugs, but really get you out of pain naturally and empower you. So no matter what you've had going on with your knee pain, I assure you I've seen it before and you are in the right place. So the way this program is going to work is that every day for the first 5 days, I'm going to be emailing you, and within that email, there's going to be a link to a video. So you're going to have 5 videos for each of the first 5 days. And we're going to have movement on day 1, movement on day 2, movement on day 3, and so on. And what we're going to do each day is add those movements to a routine. So on day 2, the day 2 routine will have 2 movements. Day 3 routine will have 3 movements. We'll go all the way to day 5, where we'll have 5 movements to create one routine. And that one routine is what you'll then do for the next 2 weeks. But it's important that you don't get ahead of yourself. It's really critical that we build a foundation. So everything you're going to be shown is in a specific order. Please do not do day 3 movements if you're on day 1. Really master these first movements, build a strong foundation, and then move forward. These videos are going to typically be anywhere from 10 to 20 minutes long. They involve no equipment whatsoever. You can do them in the privacy of your own home, in your living room. All I ask is you just get comfortable. You know, if you can have a firm surface, a firm bed or yoga mat, that would help as well. But like I mentioned, at the end of the 5 days, you will have a full home exercise program, and that's what you'll continue to do for 2 weeks. You'll also notice in the email that I sent you that connected you to this video, there was a PDF. So that PDF is also going to be super helpful. It's something that you can save to your computer. You can also save the link, put it on your iPhone or smart device or iPad, and that way you can have access to the home exercise program. And you can also print it out. It's got lots of great information about each movement, the different routines itself, how we're progressing. But it's also going to have a frequently asked questions section, and that's going to answer a lot of the questions that you may have around your specific issue based on your history. That's a way I can answer a lot of your questions there, so please refer to that first. So you might be thinking, who is this guy, Dr. Chad? What's he doing? How is he going to help me? So I want to take a moment just to give you some clarity on who I am so that we can understand each other and start to build a relationship. So as I mentioned earlier, I'm a doctor of physical therapy. I have over 15 years of experience in working in multiple settings. I've worked in hospitals, neurological settings. I spent a lot of time in outpatient clinics working with people with joint pain, back pain, shoulder pain, hip pain, all that stuff. There's really nothing I have not seen. And I've also spent a lot of time working in the home health setting. That's where I really began to specialize working with older adults, people in their 60s, 70s, 80s, and really got to see what's happening in our modern healthcare system and how we have failed to get to the root of the problem. And we've been falling in love with treating symptoms. So it's really my goal to help people get out of pain naturally and to help you kind of understand my philosophy around health. There's an analogy I like to use. It's about Shamu, orcas. You know, you might have heard of orcas in sea worlds and water parks all across the world. But there's this thing they started to notice with orcas. You may have heard about it a few years ago, but they started noticing instead of having a straight fin, they started noticing that these orcas' fins were starting to collapse, right? And this was very interesting to many people because this is not something that happens when the orca is out in nature. So they started looking at this a lot more closely and trying to figure out why orcas all across the world started having these floppy fins. And after doing that research, they found that it really came down to 3 reasons. So one reason was that the orca was always swimming in the same direction, in the same counterclockwise direction in their tank. The other reason is that they weren't swimming to deep depths, right? They were only swimming in shallow waters. And you can compare this to the way it would be out in the wild, right? They would be swimming to very deep depths. They wouldn't be swimming in just one direction. They'd be swimming all over the place, right? And the other thing is that they were eating really poorly nutritious food, which was impacting the integrity of the fin, making it more easy to tip over. So the physical deficit, the problem that the orca was having with this floppy fin, wasn't just a genetic issue, right? It had much more to do with the environment that the orca was living in. I should also mention that the orca was having a anger outbursts and attacking the trainers. You probably heard about that as well. But this type of aggression, these floppy fins, these health issues that the orcas were having in the tank, they weren't happening in nature, right? And in the same way, what I observed through 15 years of working in the modern conventional healthcare system is that we humans are living in a human tank. The way we've been eating, the way we've been moving, the way we've been living our life is leading us to experience a lot of pain. Pain throughout our spine, pain in our knees, pain in our hips, pain in our shoulders. You know, as I was working in the outpatient clinic, I started to observe that most of the people with spine pain had some of this going on, right? And I also observed, as I got to really know them and talk to them, that that issue was never really addressed in terms of fixing that. When they had headaches or tension or shoulder pain, they were given something to numb that pain rather than fix the root issue. So another analogy I like to use is, if you came home and you saw that there was water all over the floor, and then you looked over at your kitchen sink and you saw that the kitchen sink was overflowing, what would you do first? Would you start mopping up the floor, or would you go over to turn off the kitchen sink that's overflowing with water? And it seems like a silly question, but of course you would go over to the sink, turn off the water, and then mop up the floor, right? That's getting to the root issue before you start doing all the other stuff. And the reason why we're having a healthcare crisis and so many people are in pain is because we haven't done a very good job of getting to the root issue. So that is kind of describing my approach to helping people with pain. We have to get out of the root issue. And that comes with fixing a lot of these imbalances that come from living in what I refer to as a flexion-based society. This society that tells kids to sit still in their chairs, and we stay sitting all the way through elementary school, all the way through high school, college, and then we enter the workforce and we sit all the way through work. We sit as we drive, we come home and we sit and we watch TV, and it's changing our bodies. It's adapting our bodies in a negative way where it's fragile and it sets us up for pain. So a lot of what I'm doing is helping you restore your natural alignment and put your body back where it belongs so that you're whole, because that is your birthright. And along with this, I'm super big on having you improve your nutrition, drinking more water, because that hydrates your joints. Your body's 70% water. Getting outside, getting sun, looking after your sleep, looking at the food you eat, minimizing toxicity and maximizing nutrition. No matter what you've heard before, these things have a profound impact on the level of inflammation in your body, which is also contributing to your pain. It's also why I'm such a big fan of things like collagen, of things like turmeric and probiotics to help you with the integrity of your joints, your tissues, your bones, to help you with the level of inflammation in your body, to help you with your immunity. All of these things play a part and really sets the foundation of our values here at Native Path. So the system I'm sharing with you, it's worked. I know it's worked. I've shared it with thousands and thousands of people. The feedback I've gotten is incredible. People are getting off pain pills. They're avoiding surgeries. Even if they have had surgeries, they're finding ways to get out of pain from that surgery naturally. But none of it works if you don't work, if you don't take action, right? There's a conditioning thing we have to get over here. You were brought up in a society that told you just have to take a pill and you'll get out of pain. That's all you got to do. You can keep sitting there, take this pill, and you'll be fine. And that simply does not work. This program is only for people who are ready to take an active role in their health. So I can show you these exercises. I can demonstrate them for you. I can tell you and educate you about all these nutrition and lifestyle factors that you can do to get out of pain None of it matters if you don't take action. It's why we call it native path. I can show you the path, I can guide you, me and my team of coaches can all give you that path, but it's up to you to really take the steps. So what I ask is that every day when I email you, you open that email and you watch that video and you create a space and time for you to follow along and do those movements with me. And I ask that you engage with me. Comments, there's a comment section below every video. Comment, let me know how you're doing. Comment and let me know that you did this today. I want to help build this relationship over time, but again, it's important that you take an active role in your health. Now, another thing I want to talk about is pain, right? Just the pain itself as we go about this process in this 2-week home exercise program. And there's good pain and there's bad pain, right? The bad pain is the kind of pain that if you're doing a movement and you keep doing that movement and your pain gets worse when you're done, and then even maybe 30 minutes, an hour later, it's even getting worse. That's the bad type of pain, right? So whatever that movement was, and we'll continue to go over this more, that's not the right movement for you, right? There should be some slight discomfort in many of these things I'm going to show you. Us physical therapists have to talk about this a lot with our patients. But when you stretch something, when you open up restrictions within a joint, you're going to have a slight amount of discomfort. But when you stop the movement and you go back to normal, you should experience less pain. You might have a little bit of soreness. That's okay. But this pain I'm referring to here, where it comes on and then it kind of goes away, that's the good pain. So learn to develop a good relationship with that pain. Again, if you have any questions, all you have to do is comment. But I say this in advance to help you understand that there should be some slight discomfort with these exercises, is to be expected. Now, the other thing I want to say is that if you are someone who has had surgery within the past 3 months, I ask that you hold off on this home exercise program for now, regardless if you've had spine surgery or knee surgery or hip surgery or shoulder surgery, because what's best for you is really what the surgeon has dictated is what's best for you, and I don't want to interfere with that. Physical therapists are very careful to always follow the orders of the surgeon, because different surgeons do different procedures on different people and they have specific protocols. So if you are within the 3-month period of having a surgery, I ask that you hold off on this program, continue to follow the prescription given to you by your doctor and your physical therapist, and please find a good physical therapist in your area until that 3 months is up, and then you can come back to this program and we'll have something for you. And the last thing that I ask is that you start thinking differently. The way you think about yourself, the way you think about your pain has everything to do with your outcome moving forward. So if you're someone who's been dealing with chronic shoulder pain or back pain for a long time, and you're thinking it's always going to be this way, what I have observed in these type of people is they take on a certain posture. They kind of slouch a little bit and they kind of lean to the side and they put themselves in a bad position, right? And when they do this, they actually make their pain worse. So start thinking differently. Start thinking, I'm getting out of pain. I'm getting better. I'm improving my life. And when you do that, sit upright, stand upright. Really put yourself in a good position right here, right now. Your healing starts right now. Don't wait for it. Don't wait for someone else to take care of it. You're the one who's taking responsibility here. So start thinking differently and you'll start feeling differently immediately. Remember, always put yourself in a good position. These are things I'll cover more of as we go through these videos, but I want to mention it because your education and how you position yourself is of critical importance as it relates to your pain. Does that sound good to you? I hope so. Remember, if you have any questions right now, please refer to your PDF. You're going to find lots of answers there. And now let's go ahead and get started with our first movement in our 2-week home exercise program to help you with your knee. Disclaimer alert, this video is not medical advice. I am a licensed physical therapist and a doctor of physical therapy. However, I'm not your physical therapist and can't properly diagnose you through the internet. So please do not use this video to avoid going to your own healthcare professional or to replace the advice they have given you. If you experience any pain or difficulty with these exercises, please stop immediately and see your healthcare professional. Thank you. Okay, so now what I'd like to do is show you a simple knee stretch you can do to decrease any pain you might be having in that knee area. And here to help me demonstrate is my beautiful wife, Brenda, who's also a doctor of physical therapy. And behind us here is our physical therapy assistant, our little dog, Maya. So what you're gonna need for this exercise is just a simple chair. And ideally, you're in a chair where your hips are above your knees. You don't want any chair where your hips are lower than your knees, like a couch or any low surface. Make sure the hips are above the knees. It's really important because it's going to allow you to get full extension on this stretch I'm going to show you. So what you're going to do in a tall sitting position is just go ahead and straighten out your leg with about a 45-degree angle to the ground. You don't want it too high because sometimes the hamstrings can be tight and it'll prevent you from straightening your knee out all the way. So it's really important you straighten your knee out all the way. Squeeze, squeeze, squeeze. You want the foot pointed back. Hold for 5 seconds. Once you're here for 5 seconds, you're going to externally rotate, so toes pointed to the side. Again, squeeze and hold for 5 seconds. Go back to straight and then drop. And let's repeat it again. Up, up, up. Squeeze, squeeze, squeeze. 2, 3, 4, 5. Externally rotate, 2, 3, 4, 5, back to straight, and then back down. The key here is that you get your leg, and keep going, keep demonstrating. You get your leg as straight as you possibly can and squeeze it as much as you possibly can. What we're doing here is freeing up restrictions in the range of motion in the actual knee joint. Many times we're lacking that terminal knee extension in the knee, and it results in a lot of imbalanced pressure on the actual tissue within the knee joint, like the meniscus. The other thing we're doing is with that external rotation that we're doing, it allows us to get to that terminal knee extension, but it also activates the external rotators within the hip. It wakes up the hip, in other words. One of the main issues we see in knee problems for many people is often lack of activation in the external rotators of the hip. Okay, well, I hope you got some immediate relief from that knee stretch. So if you look in your PDF, we want you to do that stretch 10 times every couple hours for the rest of the day between now and tomorrow. Okay, super important that we do that because we're opening up that knee joint, we're freeing up any restrictions, we're activating the quad, and we're activating the external rotators in the hip. Both are critically important to helping you with your knee pain, okay? Other things we want to mention here to help you are to make sure you're drinking lots of water. It's about half your body weight in ounces of water every day, but your body is 70% water. Your knee joint wants water. You know, you hear things like bone on bone. I hear it needs more water, right? So make sure you're drinking enough water. Other thing is making sure that you're sleeping enough. And by enough, I mean 7 to 8 hours every night in a pitch black room. But that extra sleep, that good quality sleep, is going to help lower any systemic inflammation you may be having in your body. This is super important. And last thing I want to mention is that if you have not already, please take advantage of the Native Relief Bundle. The Native Relief Bundle is going to help you with the chemical side of the pain that you're dealing with. The exercises help with the mechanical side of pain. You want to do both to maximize your chances. So if you haven't already checked that out, the Native Relief Bundle includes collagen, which makes up your tendons, your bones, your ligaments around your knee. It also includes a probiotic, so you can improve your immune system and your gut microbiome. This is where you absorb all the foods, the vitamins and minerals from what you eat, and you eliminate the toxins so you don't get inflamed. So a good quality probiotic is super important. And lastly, it includes turmeric with piperine. And turmeric is a powerful, powerful natural anti-inflammatory, much more effective than many of those over-the-counter medications that so many people take and get addicted to. That stuff is not good. So definitely check out the Native Relief Bundle if you have not already. If you go back to the email that connected you to this video, you'll see in that email we put a link where you can get a special discount as our way of saying thank you for signing up for your 2-week home exercise program for your knee. So, okay, well, that's all I have for today. Again, do that knee stretch 10 times every couple hours between here and tomorrow. I will be emailing you again tomorrow with your next video. And in that video, it's going to have your second movement for your home exercise program. We're going to put these things together and keep you moving forward. So between now and then, be well, and I will talk to you soon. Bye-bye.